Hello friends, welcome back to my channel. Today I am going to give you some very useful tips to crack medical coding interview. Most people fear a lot while preparing for interview and also during interviews. Even I used to be scared of these interviews, but don't worry. I share with you some tips that will give you an idea of how the medical coding interviews will be. And also these tips will help you to clear your interviews. Before we move further into the video, please subscribe to my channel and share this video so that others also benefit from this video. Why most of us fear interviews? Some reasons could be our thoughts. What if I could not answer all questions? What if I am not selected? What if they ask questions which I don't know? And so on. So, this fear of failure makes us feel uncomfortable and also insecure. An interviewer seems like a horrible person who wants to reject you with tricky questions. No, not at all. Interviewer wants to hire you, not reject you. He wants you to do well in the interview. Keep that in mind. You need the job and they need you. Not like you only need the job and they don't need you. You need the job and also they also need you. So, in order to do well in your job interview, you have to take care of certain things, which I will explain in few minutes. Interview does not expect you to know everything, and they are going to train you as per their needs if you got selected. What they expect is that you have some basic knowledge of systems and guidelines, and other things are discipline and trainable. Are you trainable or not? Trainable means you should have interest to learn and do the task given to you. So do some basic preparation for the interview so that you will feel confident about yourself. So what is this basic preparation contains? First thing is resume preparation. Even before they see your resume. Your resume give them an idea about your qualification, certifications, etc. So here is an overview of what your resume should contain. First is the header. Header contains name and address. Your mail ID should be professional. Next comes the objective. Objective contains your career goals and what you want to achieve in your career path and what you would expect in your career path, like that. And coming to summary, summary includes your certification and skills. These certification and skills are the requirements they expect from you. So, in summary, if you are a certified fresher, then write about the certifications like CPC or CCS, or what are the certification you got from the organizations like AAPC and AHIMA, and what is the pass percentage. If you are having a good pass percentage, then mention all the certification details in the summary, and along with that, what are the skills. So they will expect you to have a basic knowledge of if you are a certified fresher, then you have to mention as I have a basic knowledge of medical terminology, anatomy, physiology, and guidelines of ICD-10, and also CPT modifiers, like that you have to mention. If you are a non-certified fresher, then you have to mention in the skills as basic knowledge of medical terminology and anatomy, physiology. Next is education details. You put a tabular form of the education details. It will be easy for them to understand. And coming to hobbies, if you mention the hobbies if you have any. So these things are very important in the resume. So whatever, try to keep the resume simple and clear. Mostly one page. It's about the quality of the resume, not the quantity. And one more important thing is, whatever you write in the resume, you should be able to tell about that. If they ask any questions about them, you should be able to answer about that. So be careful about what you write in the resume. So whatever I mentioned are the main things. They should be present in the resume. So this is the resume part. Next, on the interview day, The first question the interviewer asks is, tell me about yourself. So the intent behind this question is to know about what are your communication skills. So while telling tell me about yourself, we have to tell your name, courses you have completed recently, and certification and education details, and college projects if you are done anything related to the job portion you are applying. So write down an overview of your resume with all the above details and practice in front of camera or mirror. After that, review the mistakes and correct yourself. And coming to communication skills, they don't expect you to be a professor in English. So what they expect is clarity of your thoughts and how you frame them into meaningful sentences. So simple English also works fine in medical coding. Even after getting job in medical coding, you will work independently most of the time. So don't worry about communication skills. Next, coming to technical part of the interview, it all depends on the position you are interviewed for. If you are a certified fresher, then they will, after asking tell me about yourself, they will be asking about body systems. They might mention to tell about one body system, or they may ask do you know any body system, tell me about any body system, like that. They may give choice to you, or they may ask about particular body system. So it's better to prepare two to three body systems perfectly. And next, some medical terminology. And after body systems and all, they will ask you about ICD guidelines. If you are applying for HCC coded position, then you will be asked about ICD guidelines more. Like what are the guidelines for HIV, like that overview. What are the guidelines for NSTEMI, like that. I was asked about what are the guidelines of HIV and what are the guidelines for NSTEMI, what is NEC, what is NOS, like that. And next is the CPT modifiers. If you are applying for HCC, they will ask one or two questions from the CPT modifiers. They will touch the CPT modifiers, but they don't go in depth. But if you are applying for E&M, ED, then they will be concentrating more on the CPT modifiers. So this is the certified freshers. And for non-certified freshers, they will ask about body systems, basic body systems, and some medical terminology. So this is a technical round of the interview. So these are the tips you can follow for cracking the medical coding interview. So all the best for your preparation and interviews. And please subscribe to my channel for more videos on interviews and CPC preparation. Thank you for watching my video.